Hello, students. Give me a moment as I pull up my screen and get ready for the next in your series of video lectures. So today we're going to be coming out of chapter 7, and we are going to be having some discussion regarding eliminating counterproductive communication patterns. So very important topic that we need to pay attention to, because there are times when there are things that we do in the context of our work that actually impede communication. So we're going to take a look at some of these today in this particular presentation and to give you some strategies about how to avoid these things in the future. So without any further ado, let's get busy. All right, so we need to first and foremost look at our nonverbal communication. So as you know, nonverbal communication is about 30% of all communication. So it's not what we're talking about, it's not what we're saying, but it's what our body is actually doing. And so paying attention to those things are going to be very important for you as the social worker and practitioner. So making sure, one, that you are paying attention to your physical attending. So physical attending, I'm paying attention to what people are doing as we're having the conversation, where they are focusing their eyes. Are they moving about nervously? Are their arms folded? Are they seemingly relaxed? I'm looking at facial expression. So I'm looking at all of these particular things, and I also need to be aware of these things for myself as well as the actual social worker. So really looking at and understanding how people show up at the time that you're connecting with them is a very important indication on, whether there will be barriers in place or not. Also looking at the cultural nuances of some of the nonverbal cues. So in many different cultures, different things, different gestures and different expressions mean different things. So oftentimes in many communities of color, Native American, some African American, eye contact, for example, is looked at very differently. And so in some of those communities, I know, being raised up as a young African American boy in Mississippi in the 60s, when I had to engage with conversations with my elder African American relatives, then I had to be very respectful. I couldn't maintain a whole lot of eye contact, looking them in the eye. I would look down, I would make enough eye contact for them to be comfortable, and they understood that I've been listening to them, but not just kind of an intense stare down, because that would be considered disrespectful. And so in many cultures, some of the same things actually happen. Native American culture, some Asian cultures as well. So we need to be careful not to read into our own biases or our own interpretations of what we see some of the physical cues that people put off are. So do some research and do some studying about what's appropriate based on culture. Taking inventory of the nonverbal patterns of responding. So as I'm talking to people, what are some of the things that I am saying or seeing or questioning that actually yields some different types of responses? So also trying to understand what is a nonverbal behavior about, and maybe asking clients questions about things that I might see. If there's this continual no eye contact at all, and it's not culturally inappropriate. I think we also need to work to eliminate those nonverbal styles that hinder the communication. So we need to be careful with what we're doing and how we come across as well, and then sustain those. So again, it's about putting people at ease and making them comfortable in terms of what you need to do. So these are a list of things that you as a practitioner need to actually be doing. So maintaining direct eye contact except when it's culturally prescribed, being warm, having facial expression, sitting at the same eye level as the client. That's very, very important, because if I'm standing over you or if I'm sitting in a chair that's elevated and I'm looking down on you, that has some connotations. Appropriate varied animated facial expression. So, when is it appropriate to frown or to laugh or to do those things? Relaxed, occasional smiles are also things that you want to do as well. Arms and hands, moderately expressive, appropriate gesture. For those of you who know me a little bit, I talk a lot with my hands, so it's not uncommon, even in a video lecture, for me to have my hands moving as I'm actually having conversations with you all, as well as in class. So, but then I have to think about that when I'm doing interviewing with clients, to make sure that that's not something that's disruptive or is going to be problematic or become a barrier to people being able to communicate. body leaning slightly forward and attentive. So if I lean into the conversation, and you'll hear social workers talk about this all the time, then that shows and demonstrates that I have some interest. So we can clearly see what the not recommended behavioral barriers actually are to your right-hand side. So let's not do those. Clearly audible, but not loud, not screaming at people, warm tone of voice, voice modulating to reflect the nuances and feeling and emotional tone of the client. So again, as you know, you're having a conversation. I think about when we're talking to small kids, and I watch this all the time, especially when people are talking to babies. Do you notice that sometimes even grown men, when they're holding a little baby who's maybe nonverbal and they're talking to them, that they change the tone of their voice? They're often very softer and they're cuddly and they're smiling, and there's a whole different conversation that's happening with this 9 or 10-month-old baby when they're being held by this man. And we're making adjustments based on what's going to be something that that particular child can relate to. So if you think about it that way and then just kind of bring it full speed in terms of where people are age appropriately now, you want to do the same things. Being able to reflect sadness when you hear sadness from your clients, being able to empathize along those particular lines as well as when people are excited, you can be excited with them. So a moderate tempo in terms of your speech, all of these are things that are going to help in terms of removing those barriers. And then also, 3 to 5 feet distance between chairs. There's this different spaces in terms of different cultures about what's close, about what's too far away. In some cultures, 3 to 5 feet might be too far away. There are cultures that I'm aware of that do lots of in your personal space kind of a thing, and that's just kind of how they operate. They're very huggy, very touchy, very feely. So again, think about those kind of things as you're kind of moving forward with your work with your clients. So other things that you'll need to do in terms of eliminating some of the verbal barriers. So we've moved from nonverbal to verbal, and that's reassuring, sympathizing, consoling, and excusing, advising and giving suggestions or solutions prematurely. So let me back up, because I think a lot of times it gets really confusing for newer social workers around trying to understand what these barriers are, because some of this sounds like these are things that you should be doing. Shouldn't I be sympathizing? Shouldn't I be consoling? Shouldn't I be reassuring when I'm having my conversations with my client? Shouldn't I be giving them advice and giving them suggestions? So the short answer is we need to really look at the context of the relationship. Where are we in this relationship? Is this our first meeting altogether, or have we been meeting for several months? Because that will determine, how far we go in these particular areas. So if I reassure a client that everything is going to be all right, I don't have any way of knowing whether that's going to be the case or not. I don't know what's going to happen in the next couple of weeks. I don't know what's going to happen with our treatment regimen. Things could go bad. So if I reassure you that things are actually going to go well, or I console you, or I excuse your behaviors in terms of what's happening, then down the road when things don't go well, then people are looking at me, well, but you told me that things would go well. And so you've been dishonest with me, so why should I continue to have a therapeutic relationship with you when it appears that you don't know what you're doing or you're lying to me? So again, we want to avoid those appearances when we're working with our clients. So you can be empathetic, but reassuring clients or saying to people it's going to be okay, things that you really are wanting to do and well-meaning and well-intentioned, avoid, because you don't know at the end of the day whether that's going to happen or not. The other thing that I see a lot of my students do as well is they get into the advising piece. So I hear you say, that, I'm not getting along with my mom and she doesn't let me stay out late, and everybody else stays out late and I have a curfew. And so you hear that from that particular kid, and then you go into like, well, maybe you should just maybe talk to your mom and see if you can kind of go into a negotiation about can we get some additional time. Sounds really good. Giving those suggestions and advising prematurely is going to be a train wreck, because the reality is that we don't have enough information about what's going on with this situation to actually tell people what it is they need to do differently. And so until you've gotten a breadth of information around from multiple sources about this particular issue, I would advise you to not go into advising and giving suggestions, because if you do it too early, then people will stop talking. well, I'll just do what you said, and there's nothing else for us to talk about. So just pay attention to those kind of things. Using sarcasm, employing humor inappropriately, judging, criticizing, placing blame. You never want to leave out of a situation or contact with a client where they feel like they've been blamed for everything that's happening for them in this particular situation. Got to be very careful about that. You got to remain in a neutral place and really try to not take sides. You know, even though there might be a clear thing in your mind as you kind of unfold during your assessment that really kind of says, yeah, these are some things that probably should be done different. It's not your place at this point in time to really kind of point that out, because that comes across as judging, criticizing, blaming. And also, if you're going to judge me, then how are you any different than my boyfriend who judges me all the time? You're doing the same thing. So why would I need to continue to be involved in a therapeutic relationship with you because you're doing these things? Trying to convince the person about what's the right point of view, not your job. Lecturing, instructing, arguing, do not argue. Diagnosing, analyzing, making dramatic interpretations. If this doesn't happen, the world is going to end, and blah, 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 blah. As well as threatening, warning, and counterattack. These are all verbal barriers, and we need to pay very close attention to those because they will inhibit our ability to get the information that we need from our clients. There are some others. Stacking questions, leading questions, interrupting inappropriately or inexcessively. So if I'm stacking questions, you know, I might start out with, so, you know, you're not having a good time in your relationship with your brother. Well, what does your brother do? And then what do you do? And why do you think that happens that particular way? And, you know, should you be really doing that kind of a thing? So those are leading questions and stacking questions. So before my client has the opportunity to sufficiently answer one question, I've added another. So they're just kind of layered on top of each other, and it becomes frustrating. Also, asking people why. If people knew why things were happening the way they were, they would need you as a social worker. So really avoid that question about why things are the way that they are. Or why you think they're the way they are. Because if they had any idea about that, again, it would be kind of a moot point to actually having you there. Interrupting people, letting them finish their particular sentences before you get out. Dominating the interaction. If you are talking 75 to 80% of the time in a conversation with a client, you're talking too much. It should be closer to 50-50. Fostering a safe social interaction, you need to make sure that it's a safe place. Responding infrequently. So you need to stay engaged in the conversation, listening and respond appropriately, as well as, you know, rather than wait till every 15 minutes to have a response to what you hear a person saying. Parroting or overusing certain phrases or cliches. Oftentimes, there's a lot of jargon and acronyms that we use in our profession. Clients don't have any idea what that means. So we need to really stay away from those. And just kind of explain things as we go along. And we don't need to continue to say the same thing over and over. So that's that whole parenting piece. And then dwelling on the remote past. So again, we're not, you know, there's nothing we can do about what happened last week. What we can do is we can start to really think about what we can do to make this week better. And then going on fishing expeditions. So that's not actually getting in a boat and going fishing. That's actually asking a series of questions that you're just trying to draw information and it doesn't seem to be coherent or coming in any meaningful fashion. I'm just kind of looking to see what's out there. And those are all things that will really inhibit your ability to continue to engage in an appropriate way. So, you know, you want to also gauge whether, you know, there's some effectiveness in terms of your response. So, you know, if people are expressing pent-up emotion, if they do deeper self-exploration, if they volunteer more personally information that's relevant, if they have validity of response verbally and non-verbally, if I'm leaning in, I'm nodding, hearing you kind of sharing pieces, if they want to continue to explore the topic or the problem, then that means I'm probably being effective in terms of the way that I'm communicating both non-verbally as well as verbally. If I see the things below here in terms of things that are ineffective, if these are happening for you as you are interacting with your clients, or these are the things that you notice, then there's something about your particular interaction that might be driving some of that. So again, it would just behoove us to really take a look at the effective responses before we move forward. And this, I will have to say to you, as a new social worker, it's really challenging to really try to understand some of those verbal and nonverbal cues that people might be involved in that really inhibit communication. But it's important because it's something that we really have to do. Um, so learning to take feedback is going to be really important. You know, what you did well, what you didn't do well. Because it's all about helping you try to grow. So if you have to be the person that always gets it always right, you're probably going to struggle in the field because none of us get it all right, not even me, your instructor. So just to be open to that particular process as well. Supervisors should focus on what the social worker does well in addition to their errors. And so again, you know, when you're working with a client and someone's observing that particular work, there are things you're going to be doing well, there are things that you're going to need some improvement. And so being able to have a balanced approach is what I try and do. So even, for example, when I grade your papers, I will usually have some comments that talk about the things that were working well in the paper, as well as the things that need to be improved. So again, thinking about it from that way. And then social workers should monitor their own growth, such as using videotapes for self-observation. So those are things you can do. And actually, one of your competency assignments for this class will be that you will actually do a videotaped interview, and I will actually accept that in for a grade in terms of your interviewing skills and how well you're able to do these things. So more to come about that. Here are just some tables that you can look at in terms of kind of a rating piece for yourself. We're going to do one of these in class as well. So we'll have an interview that will have you guys role play with each other, and then someone will actually take notes about how many times you do each of these particular things. So again, these charts are really helpful in terms of being able to help you understand these particular barriers, verbal barriers that you might be experiencing, because, you know, and they happen for us all the time. I've been in social work for 38 years, and there are times in interactions with clients that I actually do a bonehead move and do a barrier, and without being aware of that piece as well too. So it does happen, but it's something that will happen less the more we practice and the more we become aware of those things. Making sure that when we're doing the physical attending, the direct eye contact, all of these things that we talked about a little bit earlier, and rate yourself in terms of that particular area as well. The warmth, you know, not being distracted, other things that are happening for you as well too. So that pretty much brings to a conclusion our segment on eliminating communication barriers verbally and non-verbally. So I encourage you to read your text and to come to class prepared, and we will actually do an exercise in class that will have you actually do this. So see you in class.